Basically, I had my pain since, well, many years, I think more than 10 years. So recently, I couldn't stand anymore. My name is Joyce. I'm 61 years old. Before my surgery, when I walk more than like 1 kilometer, I barely walk, When I lie down, when you press on it, it's really painful. I did so many things, massage, all the traditional way, but it seems that it doesn't help. So I searched from the Google. So I found Dr. Siva from SJMC. I went to see him and we have a discussion on my hip problem. He was saying that my hip cartilage is already against bone to bone, and he suggested that I should do a surgery to replace the 40 parts, so-called. So he explained to me he's going to use Mako, the robotic system, and the anterior approach to minimize all the pain, to speed up the recovery.
Okay, so when you talk about types of hip surgery, it's actually a very broad question. So you can talk in terms of the type of surgical approaches, like how do we get into the hip. We can talk about the type of materials we use. Then we have something called the types of bearing surfaces. You can talk in terms of the type of implant. When I was working in the West, their hips are a lot larger. It's a more safer sort of anatomy to do a hip replacement in. Our patients usually have much smaller hips. I would say they are probably more challenging here in Asia than it is in America or in the West. The anterior approach has only in the last maybe 15 years been used for hip replacement surgery. Now, the advantage of it is that it is a minimally invasive. What that basically means is not the size of the skin cut, but the fact that on the inside, it's a muscle sparing approach. So you don't cut through muscle, rather you split muscles to go in. So basically with my patient, it was in terms of the approach. She's an ideal patient. She doesn't have any other medical issues. She was fairly thin, which is one of the criteria of doing anterior hip surgery, because if you've got a larger abdomen, then it's very difficult again to maneuver into the hip. She was active, she had good muscle strength and good muscle power. Anterior hip surgeries are the way to go. If you see the outcomes, patient regaining muscle strength, range of movement is far faster. With Mako, now what Mako does is that, you see, we do a CT scan of the leg, we know exactly where everything is. And then when we open up and do surgery, we match the patient anatomy to the CT. We can place the cup in the acetabulum. I can make a hemispherical cavity in the acetabulum, accurate to about 0.5 millimeter to 1 millimeter. So this risk of blowing out the front wall or the back wall or needing an X-ray or not being able to assess, all that is eliminated. So Mako has made it a lot more easier to put implants in. The fact is that by using Mako, I was able to reduce the time that I had to, instead of reaming multiple times, having a lot of bleeding, I put in one reamer, reamed right in, put the cup in. So the risk of the bleeding was so much lower and made it so much safer for the patient.
I actually walk the next day, which I'm very surprised as well, because normally people say after the surgery you won't be able to walk for like how many days. No, actually I walked the second day in the morning. Basically I can stand and walk using the walker with the help of the nurse. 3 months later, I'm basically this normal person, and if I don't tell you I had a surgery, there's no one can really know that I did a surgery. So right now I have no problem doing yoga, walking. Well, I'm very happy, and also I go for hiking now. I'd like to thank Dr. Siva for helping me before the surgery to diagnose the actual problem, and also suggested me to do the surgery.